Good morning, Secretary of State. Welcome to our summit. Thank you very much for coming. First question is on quality. Mid-staff's 290 recommendations. What are the priorities, do you think, for the NHS now?
I think the priority is to make sure that we have a system where on the front line, people are able to do what they came into the profession to do, which is to treat people with dignity and respect and care and compassion. And that happens in many places throughout our NHS. But there are parts of the system where that doesn't happen, where we have a culture of compliance rather than always sticking to the letter of targets. I think we have to think about the spirit of targets, and we have to give people more freedom on the front line to do what it is that they came into the NHS to do in the first place.
But of the 290, what might be the priorities, given it's a huge number?
Well, I think there are four areas really that are the most important priorities. I mean, the first is to get the culture right with the NHS, and I think that the new Chief Inspector of Hospitals will help to do that, because having a Chief Inspector, it will set a very clear standard as to what the right culture should be, and we'll have one definition of success. I think we need to be much quicker at identifying failure where there is failure, such as we had at mid-staffs. Then we need to have a much tougher and more robust way of sorting that out. And finally, we need accountability where things have gone wrong. People need to know that if there are lapses, the people responsible will be held accountable. So those would be the four sort of broad areas, and we'll be responding in each of those areas.
Big questions about sustainability of the NHS, how it's going to become more efficient in future. Consensus here at the conference that addressing longer-term conditions is going to be the issue, taking stuff out of hospital, treating and preventing illness. What are the biggest items of your reform programme that are going to address that?
Well, I agree with you. I think that is a very, very fundamental issue, and I think the reforms and the new structures we've got will help that, because they allow much more local autonomy and much more freedom to CCGs to form partnerships so that they can deliver integrated care on the ground. They're obviously closely linked to GP practices, but also to secondary care and to the social care sector. So I think that's one thing. But I think we also need to look at a much more fundamental change in the role of GPs. And we have to recognise that GPs are working extremely hard and flat out, and we have to ask what could we do to free up GPs' time so that they can more proactively look after the frail elderly, people who have long-term conditions, the people who are the most regular visitors to their surgeries. And I think that requires a lot of thinking, and I think one area where we can particularly make progress is the use of technology, because I think that can help deliver an integrated service, because it can mean that wherever someone goes in the system, people can access their medical history, their prescription history, can understand about them. If an ambulance comes in the middle of the night, can know that someone's a diabetic or someone has had a few falls, or whatever the issues might be. It's a very big change. We're not by any means through on the journey on that, but I think it's absolutely the right focus.
Another question, competition. A lot of kerfuffle, a lot of froth about Section 75 regulations. What do you think the place of competition is in the health service, particularly in pushing it towards more efficiency?
Well, I want innovation in the NHS, and I want to learn from what new providers might be able to offer, and I think we see a lot of innovation that comes in the traditional NHS, but we also see it in the voluntary sector and the independent sector as well. But competition is not an end in itself, and I think what we want is local autonomy. I believe in clinical commissioning, local clinical leadership, so I think this has to be a decision for people on the ground. If they think that they can harness and foster innovation using traditional NHS providers, that's great, but if they think there's a role for other new providers, then they should be allowed to do that too.
And in your mind, is competition a major engine for change, or is it something that we just increase incrementally, or is it indeed marginal?
Well, I think it's one of the things that can help drive change, but I don't want to see competition that leads to fragmentation. I think one of the big priorities when it comes to the frail elderly is delivering a more integrated service, and So I think, we have to allow people on the front line, local clinicians, local doctors, local GPs, to construct the best possible services for those people.
Okay, Secretary of State, thank you very much.
Thank you.